Welcome to the City Club of Eugene's June 25th, 2021 program. The name of it's What's Being Done About Elder Abuse. This is the 38th program for our 2020-21 programming year. My name's Kitty Piercy and I am the City Club President. Support for the City Club is provided by our members and sponsors. You can become a member of the City Club at our website, cityclubofeugene.org. Our programs are always available on our YouTube channel and on our Facebook page and are broadcast on public radio station KLCC 89.7 on Mondays at 7. We have both business and in-kind sponsors, including our diamond sponsor, Kaiser Permanente, University of Oregon, Peace Health and Lane Community College, as well as generous support from the City of Eugene and from Lane County. In today's program, we welcome Nicole Newell, a manager with Adult Protective Services, Brenton Gicker, a registered nurse with Cahoots, and Chief Bob Morris from Junction City Police. Biographical information on our speakers is available on our website, cityclubofeugene.org. I would like to thank Joel Corin for coordinating today's program. World Elder Abuse Awareness Day is recognized annually on June 15. How prevalent is elder abuse locally? And how is it addressed? Multiple surveys of seniors show that up to 15% experience abuse every year. Yet the problem is vastly underreported. With an estimated 70,000 seniors in Lane County, elder abuse likely affects someone you know, but remains largely hidden. In this program, Nicole Newell, manager with Adult Protective Services, Bob Morris, Junction City Police Chief, and Brenton Gicker, RN Cahoots, discuss the problems, responses, and interventions available for addressing elder abuse in our community. They describe how each agency responds to the concerns and how the agencies collaborate and how each of us can help with this problem. Our format today includes a question and answer period with City Club members via Zoom.
All right, thank you so much for having me today. June is World Elder Abuse Awareness Month, and our team here is really interested in doing our part to raise community awareness and increase prevention. I've been with the APS unit for nearly 7 years, and each year I have really recognized an increase in reported and substantiated abuse. The reason we wanted to present today with 2 community partners is to give you all a better understanding of the individual work we do, as well as how we collaborate together to increase safety in Lane County. We want to make sure our community knows who and how to call when they run into situations with their friends, neighbors, and loved ones. So to start, Adult Protective Services embraces a social model of intervention with a primary focus on offering safety and protection to the alleged victim or person of concern. We are civil investigators, not law enforcement. That's where our friend Chief Morris comes in. We fact find to determine if abuse has occurred, but we're also really driven by working with clients to establish safety plans that are person-centered and focused on harm reduction. We are tasked with balancing safety with an individual's right to self-determination, which can be pretty tricky. Adult Protective Services has 9 abuse types, with the most common being financial abuse and self-neglect. For those of you who are unfamiliar, self-neglect is a situation where someone is confused with possibly with dementia or Alzheimer's and doesn't recognize the danger or harm that occurs related to that confusion. For someone to be eligible for our services, they must be age 65 or older, or an individual who identifies with a physical disability that prevents themselves from protection. We complete abuse investigations in both facility and community settings. So for facilities, those would be adult foster homes, assisted living facilities, residential care facilities, and memory care. We do not do nursing facilities. Those are federally funded and federally regulated. And then community settings would be an individual's home or wherever our victim is residing. It's also important to note that we cover all of Lane County, not just the metro area. So to give you a little more context into why our work is important, the World Health Organization statistics show that in 2019, around 1 in 6 people 60 years and older experienced some form of abuse in community settings. However, that same year, they believe that only 1 in 24 cases were actually reported. So that means that we all likely have individuals in our circles that have experienced some sort of undisclosed abuse and are potentially struggling in silence. To give you some local perspective on statistics, Lane County APS completed 5,554 screenings or calls of abuse from July 2019 to July 2020. Of those 5,500 calls, 2,214 cases were assigned for abuse investigations. Of those assigned abuse investigations, 22% of them were found to be substantiated, meaning that abuse or neglect occurred. Elder abuse in and of itself can lead to serious physical injuries and long-term psychological consequences on a group of individuals who are more likely to be isolated to begin with. We also know that elder abuse is extremely expensive. In 2010, a study from Virginia Tech estimated $2.9 billion loss by seniors to financial exploitation. And that was kind of the low end of estimates, with some of the studies suggesting up to $36 billion nationally per year. So after an investigator meets an alleged victim, as I mentioned before, we try to implement safety plans and interventions that not only support the individual's immediate and long-term needs, but we also do our best to help prevent abuse from happening in the future. In my time doing this work, I found that the best safety plans and interventions are really when we can have a community response. We rely pretty heavily on our community partners to not only call us when they become aware of abuse, but we also work together to increase safety. I have hundreds of case-specific examples where cahoots or police were called to inform us, who called us to inform us of a situation, and vice versa, me calling them to seek their assistance and support for an individual. At APS, we so appreciate the collaboration and referrals because we know we are barely scratching the surface in reaching vulnerable seniors. The official 2020 census numbers are coming, but the most recent estimates I could find indicated that Lane County has more than 70,000 seniors. So in our last fiscal year, we only investigated 2,214 cases. That tells us that we're probably missing quite a bit of people. The best part about our collaboration is that we all have a different approach and goal when working with an individual. So to give you kind of an example, let's say a self-neglect situation, we might get a call from cahoots or police informing us of an individual who is living alone and a neighbor found them confused and in the middle of the street. The neighbor knew to call non-emergency police, who then dispatched cahoots or officers to assess the situation. They were able to get the individual safe for a night, but then they have to leave for their next call. So from that initial neighbor call, they didn't know about APS, so they called police, but we will likely get our own referral. They will cross-report it to us, either cahoots or police, whoever was out, so we can go out and meet the individual. From there, we can do our own cognitive and risk assessment and help them maybe set up delivered Meals on Wheels, connect with their doctor around medical changes, and kind of reach out to their own community to increase in-person supports. Cahoots or police will address the initial kind of in-the-moment needs, but we can come in and investigate the concerns and work to implement more long-term solutions for safety. The same can be said about all abuse types that get us to the door. So we might go out on an allegation of a verbal abuse call by an adult child. And when we go out and meet that individual, we might find that they have numerous unmet needs that are completely unrelated to the reason we got called. So we are not ongoing case managers, but we do our best to build rapport with individuals, understand their story and struggles, and see if there's anything we can do to help support their ongoing health and safety. Before we move on to hear from the other two speakers, I just kind of want to emphasize everyone's part in reducing elder abuse. So we know that elder abuse is grossly underreported, so we must rely on our community to talk with their circles about elder abuse. Asking people how they're doing and being present to listen to someone who is struggling can really go a long way. then call us. Call us if you know things are happening. Call us if you think something seems off. Maybe somebody has had a change of baseline. Maybe the person is no longer as interested in doing the things that were really important to them. Or maybe somebody presents as fearful to disclose information to you. Our phone lines are open Monday through Friday from 8 a.m. to 4:45 p.m. If your concern doesn't quite meet the definition of abuse, which allows us to assign an investigation, we will do our best to provide the caller with the resources or ideas that might meet their needs. So our Lane County number is 541-682-4140, and our statewide number is 1-855-503-SAFE. We have also put on a few trainings this month that take a deeper dive into our work. If you're interested in learning more about elder abuse and the work Adult Protective Service specifically does, you can visit our website at lcog.org for access to recorded trainings. So I think next we'll move on to Brenton Gicker from Cahoots.
So my name is Brenton Gicker. I'm an EMT and a registered nurse. I've worked for Cahoots since 2008. For those of you who don't know, Cahoots is a program of Whitebird Clinic, which is a social service that's been around for, I think, about 50 years. And Cahoots is kind of a mobile wing of Whitebird. We are a mobile crisis intervention team that is staffed by counselors and nurses and EMTs. And we handle a significant portion of the non-emergency and non-criminal calls for service in the Eugene Springfield area. So basically we're kind of a medical, mental health, social service team that handles calls that would otherwise go to the police or the fire department. And we also respond to calls with the police and the fire department. We, our focus is on psychosocial issues. So a lot of calls involving people having mental health problems or failure to thrive kind of problems, substance abuse problems, that kind of thing. A lot of those calls will get routed to us instead of the police or the fire department. As far as the elderly population, elderly people can call us just like, people from any age group or any walk of life can call us for certain types of problems. But a lot of times when we interface with the elderly population and when we end up making calls to Adult Protective Services, are following welfare check type calls like Nicole described. So for example, somebody might notice that their elderly neighbor has been acting strangely, or that they have been their hygiene has been really poor, or maybe their mail is piling up, or newspapers are piling up, or somebody might notice that something's wrong and or something seems concerning and they're not sure who to call. So in the Eugene Springfield area, if you call 911 or you call the non-emergency police line, those types of calls might get routed to us, and then we get dispatched to come and check on the person and see how they're doing. In some cases, they're doing fine. In some cases, we do encounter people that have fallen and broken their hips and that kind of thing. We do sometimes find people deceased. Sometimes we find people that are sick or maybe are going through some kind of decline. I think one of the more special parts of the job is that just like we may be one of the first agencies to work with a young person who is having their first symptoms of major mental illness, we might also be one of the first agencies to encounter an older person who's having their some kind of life-changing event, whether it's they're developing dementia or they're becoming unable to care for themselves. So we might be one of the first points of contact, and we come out and assess things. And in some cases, we take people to the emergency room. In some cases, we just check on the person, and depending on what they want and what they need, we might call Adult Protective Services for follow-up. In rare cases, we encounter people that are in such bad conditions that we end up calling an ambulance for them, that kind of thing. But as far as the elderly population, a lot of our kind of most important interventions with them start with a welfare check. Somebody, whether it's a doctor's office, a neighbor, a family member, calling because they're concerned about somebody. We get sent out, get to assess them mentally and physically, and assess their circumstances, and try to connect them with the right resources from there. I think that's all I've got for now.
So I think next we have Chief Bob Morris from Junction City.
Thanks, Nicole. I appreciate the opportunity to participate. You and I have worked together on a number of different events. And from a law enforcement perspective, you had explained that you're a civil investigator. You investigate civil related incidents. The law enforcement community investigates criminal. And a lot of the public doesn't understand the difference. They call very oftentimes with civil matters that we can't do anything about. Law enforcement, we investigate criminal laws. Those are laws that are enacted by the state legislature, and we are the ones that are responsible for investigating those, whether it be a traffic crash or whether it be a home burglary or something like that. As it relates to the senior community, what we're looking at are crimes of elder abuse, neglect, criminal mistreatment, as well as the entire other array of crimes from assault to rape, to harassment, to disorderly conduct, a lot of different things like that. So the law enforcement community has a responsibility to the elder community to protect them just as we would any other vulnerable population, as well as the rest of society. So very frequently what happens, we will get a call either from a neighbor or from APS or a concerned relative that thinks that their friend or their grandmother or their aunt or whatever relative is acting differently, or very frequently they just haven't heard from them in a number of days, which is out of the norm for that person. So law enforcement goes out, tries to make contact at the residence and establish if the person is okay. Very frequently, when you're dealing with the senior community, they don't understand technology. They've been given cell phones by their family. They don't know how to use them. And oftentimes the ringer is just simply shut off, or they didn't hear it, or there was some other kind of a technical issue where they couldn't answer the phone. There wasn't a medical issue. There wasn't anything wrong. They just didn't understand the technology. But while we are out there, we will also try and visit with the person, establish that they do have the mental capacity to care for themselves, that they've got the ability to call for help if they need it, as well as who's caring for them. Are they caring for themselves? Is there food in the refrigerator? Is it outdated? Do you have mold in there? Do you have milk that's been in there for 2 months? We're going to look at that kind of a setting. So we're going to take kind of an initial look at the environment. Is the place clean? Is it safe? Is it free from trip hazards and that type of thing? So what we're doing from what we call a community caretaking standpoint is we're looking at a much bigger picture. We got a call that the person had not been heard from in a certain amount of time. We will go out there, one, make sure that they are okay, that they haven't succumbed to some kind of an injury, or that they're laying there in an injured state and can't get to a phone, or if somebody's abusing them. But beyond that, we're going to take a look around the house. Does the house look safe? Is there power that's on? Do they have the phone service? Has the phone service been disconnected? Do they have adequate food? Can they get to that food? Do they have medical transport? Do they have a way to get to the doctor? That type of thing. So from an initial standpoint, we're going to take a look at a much bigger holistic picture as to what's going on with this person, and can we connect them with services that would help them if they aren't in an abusive situation. One of the things that a lot of people don't understand is that you think of hypothermia and people think cold, they think they're out up skiing and somebody gets outside and it's, 30, 20, 15 degrees outside and they get hypothermia from that. Very frequently, we will find seniors that are hypothermic and in need of medical care and they don't even realize it. But the average room temperature at which the elderly person becomes hypothermic is a frigid 68 or 70 degrees. So what's comfortable for you and I isn't necessarily comfortable for somebody who's not ambulatory. By that, I mean that they're not able to get up and move around. They're not going out and talking with people. They're not going to the store. They're just sitting there sedentary. And because of that, their ability to thermoregulate or control their body temperature is compromised by their age and lack of physical activity. So when we go into a house, just because it feels comfortable to us at 68 or 70 degrees, oftentimes we'll touch their skin to see if they're really, really cold and take a look at it from a medical stability standpoint. Do they need to be seen by medics, and then subsequently maybe followed up with physicians? Do they need emergency treatment? So if you've got friends, if you've got relatives, you've got neighbors that are elderly, it's really good for the community to watch out for those people and just interact with them, visit with them, check in with them, determine what their day-to-day pattern is. So if something looks out of ordinary, they pick up on it very rapidly, as opposed to not catching it for a couple of days or longer. So let's get into a situation where there is maybe abuse. So we'll go out, the person hasn't been heard from, we'll talk to them, we'll start visiting, and they've got a son, a daughter, a friend, somebody that has stepped up and said, we'll care for you. But the problem is, you look around the house, it's a very dirty environment. There's a lot of trip hazards. There's a lot of things that are going to be unsafe for the person. Maybe their medication hasn't been refilled for 2, 3, 4 months, but yet this person is there, oftentimes receiving compensation to care for them, but they're not doing it. You've got the other thing where they've got access to the person. Maybe the person suffers from some kind of a dementia, some kind of a incapacity to actually cognitively think through things. They don't understand what's happening around them. And the person who is their caretaker is actually taking from them, they're stealing from their bank accounts and that type of thing. At that point, when we've got probable cause to believe or reasonable suspicion to believe that something is up, we're going to start looking at it from the criminal investigation standpoint. We're going to open a formal investigation, and we're going to start interviewing the relatives. We're going to interview the person who's the subject of this, who may be classed as a victim, depending on what we find. And we're going to talk to the neighbors. We're going to try to get access to bank accounts, and we're going to start looking around, trying to see exactly what's happening. Do we have an elder abuse case that's financial? We've also got people who are physically abused, both physically, like just from an assault. We've gone into care facilities, foster homes and stuff like that, where the person that we're checking on has bruise marks where you've got the imprint of a hand on the person's arm. Seniors oftentimes bruise easier than younger individuals. And so when somebody grabs a hold of them, they may leave a handprint. That handprint may be justified if they were trying to catch the person from a fall, but that's how we start looking at it. We look at it with a very suspect thought in mind as to what's happened here. At the same time that we are investigating, and we're going to notify your agency, APS, and let you guys know that we have an active criminal investigation going on, and that we enlist you guys to help. And you can start looking at it from the civil side, trying to help determine, has there been an abuse situation that you would sustain? And there are times that your agency may sustain something that is an abuse, while at the same time, we don't really find enough there to proceed criminally. You may have some tools that we don't have, where you can go after the situation from a civil standpoint and take some kind of action and get the person the help that they need. Once we determine that there is a crime that has occurred and that we have identified a suspect, and we've got probable cause based on our investigation to believe that that person committed that crime, whatever that crime was, what we are going to do is then make an arrest, and we're going to type up our reports and combine them with your reports and send them to the district attorney's office, who will then make a decision if they're going to proceed with prosecution. Again, just because we find that there's probable cause or you determine that you've got a sustained abuse situation does not mean that the district attorney's office is actually going to pursue prosecution. And that is a decision that is left up to the DA's office. A lot of people get frustrated with that because they say, well, law enforcement didn't do anything. APS didn't do anything. Just as you have limits and law enforcement has limits, so too has the DA's office has constraints that they have to operate within. So it's not that your agency isn't doing something or our law enforcement isn't doing something. It's the fact that the DA has looked at it, and based on case law, based on the totality of the circumstances, the district attorney's office feels it's not in their best interest to proceed with prosecution. And at that point, the case is going to be suspended. But the APS is going to continue to be involved and follow on and try and make sure that this person is connected with the resources that will best serve them and help them live a safe and happy, healthy life. With that, I'm going to turn it over to Carmel Schneider. She is the Associate State Director for AARP for Oregon, and I believe that she's got some questions.
Thank you. I appreciate it. And it's a great information. AARP Oregon and AARP in general, we hear often about the financial abuse of older adults and vulnerable adults. And research shows that roughly about 2/3 of the abusers are family members, often the victim's spouse, adult children, grandchildren, sometimes it's a friend or a neighbor as well. And everyone has the right to be safe from physical or emotional or financial abuse, neglect, or abandonment. Yet this underreported crime is either because people who see it or think they're seeing something don't want to get involved. People worry that their concerns are not warranted, or the victim doesn't want their loved one, even when they're an abuser, to go to jail. So how can people be aware of and report this type of abuse, and what are some of the signs that you all could share with us today?
Nicole, do you maybe want to lead off with that, and then I can kind of
Sure.
follow up?
Yeah, perfect. Thank you, Carmel, for that. You nailed it, right? A lot of times people, victims, family members are concerned about the ramifications that could come to the alleged perpetrator. And so that there's a lot of fear and there's a lot of unknown with systems, right? Once you get somebody involved, you don't know how far that will go. And so that comes to us right around education. But a lot of times perpetrators that are abusing individuals are abusing them in more than one way. So there might be some threat of physical harm, or there might be verbal abuse that's reinforcing somebody to stay quiet. And so, our office is only as good as the people that call us. So for friends and neighbors, if you're noticing changes of behavior, so that could be they've lived in their home for 30 years. There's never been any issues that we know of. Now we notice a big red sign on their door saying that their electricity is going to be shut off, or maybe they no longer have the funds to pay for their lawn care, right? So that kind of starts to come up. So really looking at changes of condition is kind of one of the bigger signs that people in your circles will notice first and can kind of start asking those questions.
And Nicole, that's kind of what I was talking about during my presentation is, get to know your neighbors and certainly get to know your relatives. It's good, although relatives don't necessarily get along all the time. I get invited to a lot of parties of which I don't wish to be party to, with people doing family disputes. But in reality, as a society, we have a responsibility to care for our elderly community, to care for our elders. And just paying attention to them, even just a phone call once a day to check in, say, hi, how you doing? And develop what you see as a pattern. If it's neighbors, like you said, if you see all of a sudden the lawn's not getting done, maybe the car is not moving out of the driveway, maybe the person used to go out to the store all the time and they would, take their walker or go out to their car, and all of a sudden you don't see it. Paying attention to that and being aware of that, becoming aware of that, then it becomes really obvious the day that you don't see it, or you haven't seen that person for a couple days. That's when you get a chance to either go over and knock on the door. If somebody for some reason feels it's not safe, then that's why we get the call that, they just feel awkward. They want to remain anonymous. They think that their neighbors are going to think that they're watching or spying on them. So they call us and we keep it anonymous. We don't tell them who called other than just a neighbor. But what we will do is once we go out and talk to the person, we will encourage them to visit with the neighbors, get to know their neighbors, talk to them, because clearly the neighbors are concerned, or the relative or whatever, and we will try and get them in touch with them. One of the reasons that people don't report stuff is that the victim many times will, and this is nothing more than different than in domestic violence cases, is the victim will protect the perpetrator. The victim either feels in fear of further harm, the victim feels that they're going to be abandoned, and being alone is terrifying to them. And if they think that there's a chance that that person may be going to jail or may just get mad and leave, may be terrifying enough to the victim for them to conceal it and not actually act on it and say enough is enough. And they realize that they can actually go through and do further harm to the person without reporting it. One of the things that we see quite often is intimidation, that the abuser will actually say, if you say anything to anybody, I'm going to leave you. I'm not going to talk to you. I am going to withhold your food. I'm going to withhold your medication. People sadly will use pets as leverage as well. If you don't, give me your money, or you don't, provide me your car or whatever, I'm going to hurt the dog, or I'm going to hurt the cat. And that's terrifying to people. So you'll get neighbors that do report it, but then you've got victims that go to great lengths to protect their abuser because that abuser has gained control of them. And that becomes a huge hurdle to overcome, which I'm sure you've seen.
Yeah, and just to touch on that too, Bob, because you make a really good point that I didn't mention earlier, is individuals who are already really isolated and have a pretty small circle, they might depend completely on one individual. And so they might say, well, I need this person to drive me to the store and get groceries. And so I know that if I turn them in, or if I get somebody else involved, then I have nobody to rely on. And so it might not even be, active threats, but just the recognition that, as people age and they become more isolated, they have less individuals to rely on for supports. And so that's something that we look into as APS, right? Is making sure that people have a bigger social safety net than when we got started.
Carmel, did you have any other questions?
Thank you.
You're muted.
All right. The follow-up question I have, and this might be more for the chief, is that we are often looking sometimes at caregivers, not necessarily a family member, but maybe someone who comes into the home, or even someone who they're just contacting over online, that are total strangers that are trying to isolate them from family. What are some signs that family members should be looking out for? And to bring Brenton into the conversation, Brenton, what do you all look for when you go out and check on older adults?
From the law enforcement perspective, for people, things to look for is, again, that pretty much the same thing that Nicole and I have been talking about, is changes in behavior, changes in daily patterns. You've got the person who was formerly very gregarious, was always talking to neighbors, was always talking to relatives. And oftentimes it happens over an extended period of time. The control starts very, very minor and just continues to amp up as time goes on, to the point that the person doesn't go out with their friends anymore. They don't go outside. They don't go to the store. They don't talk to people. They don't call the relatives. And they've basically secluded themselves in their home environment, and the only person that they interact with actually becomes their abuser. And so it becomes very apparent, but in order for it to be apparent, you have to be looking to see it. So from the law enforcement perspective, from a global view, that's one of the things. And really, it's no different than domestic violence or grooming young people for sex trafficking or human trafficking. The patterns are the same. It's the demographic, the victim demographic is just different. And in this case, what we're talking about is seniors. And I don't know if Brendan can offer some other insight to that beyond what I've said.
Yeah, I think, you know, part of what sort of distinguishes us from the law enforcement is because, I mean, there's a lot of, in these types of scenarios, I think there's a lot of overlap in what we do, but we aren't generally dealing with criminal matters. I mean, we do sometimes encounter them. Sometimes we encounter abuse or, you know, exploitation, in which case we're, you know, always following up with APS and maybe the police. But what we, our role is more about when usually it has more to do with somebody who's declining, who's failing to thrive, who's when there's not necessarily a concern that somebody is being mistreated, but that they're being becoming unable to take care of themselves. And so a lot of the calls that we get are things like, yeah, like Nicole and Bob mentioned, like somebody's lawn has become overgrown, or their mail and their newspapers are piling up, their power has been turned off. Maybe you know, a neighbor went over to check on them and noticed that their living space is really foul smelling, or they, you know, somebody has appears emaciated, that kind of thing. And a lot of times, I mean, sometimes we get called by family members or caregivers for help, but a lot of the people we're seeing are people that are relatively isolated. Maybe they're retired, their kids are grown up and live out of state, their spouse is deceased, and so they're living on their own and maybe don't have enough, aren't getting enough attention. And so I mean, we sometimes call APS not just because, I mean, maybe somebody's really, it may seem like somebody's doing really poorly. Maybe we go in their house and they're keeping their home warm by you know, leaving the stove on or something like that. And then maybe they're a hoarder and they've got piles of newspapers everywhere, and that, you know, presents concerns. Maybe they've got you know, wounds in various stages of healing, so it, you know, that, you know, indicates they've been having falls. There's all sorts of things that might alert us to the fact that somebody's not doing so well. And because we have, you know, medical staff, you know, we can check people out, we can take their vital signs, we can, you know, do a kind of physically assess things, as well as, you know, assessing their mental state and their environment. Another thing too is, you know, a lot of the calls that we'll get will be because of things like somebody misses a doctor's appointment, or, you know, so again, just these things that that tip somebody off that, you know, maybe somebody's not, you know, doing so well, or that there's something has changed for the worse.
Could you all share contact numbers where people can report if they have a concern?
Yeah, so for Adult Protective Services, our local line here for anything in Lane County is 541-682-4140. And we often get calls that are kind of misdirected. So it might be in a situation that's occurred in a different county, or it might be regarding an individual that doesn't meet our criteria. It might be an individual who has a developmental disability, or one with a mental illness. And so we are kind of the hub. So we'll take the referral and we'll send it kind of where it needs to go. But we also have a statewide number that individuals can call, and that's 1-855-503-SAFE.
One of the other things that we haven't talked about, Nicole, which again, you're aware of, and this doesn't necessarily come down to in-home abuse like a caregiver or anything else, but it helps from an education standpoint if the community partners, community leaders, whether it be social service organizations, whether it be local service clubs like the Lions or the Moose or something like that, or law enforcement, is daily we are taking reports of people who have lost thousands of dollars from telephone scams, asking people, calling up and saying, well, you know, your grandson or granddaughter is in jail and you need to post bail. I need you to go to Target and purchase $5,000 worth of gift cards, scratch off the numbers on the back, take a picture and send it to me on your phone. Or just call us and give us the credit card numbers, because that money is going to be gone within seconds. As soon as the perpetrator gets those ID, the card numbers and the security codes off the back of them, that money is out of the account and you're never going to track it. Very frequently, these are perpetrated from overseas, which makes it even more difficult to get. But we as a society have an obligation to educate our seniors to not give money over the phone. Don't give out their identity. They'll call up and they'll say it's a Social Security office, that they're going to take all their Social Security away, and they panic and they start taking money out of their bank account to pay off fines or whatever they're being told. So that's something else that as a community, we need to do a better job educating the senior community on that. And again, that's something I don't know, Carmel, is that anything that ARP does? Do you guys have any kind of workshops or anything that deals with that?
Well, I'm so glad you asked. And I don't think I'm supposed to be answering questions, but I will definitely share some information. We actually have the Watchdog alerts that people can sign up for, and they can also call our helpline, which is 1-877-908-3360. And that's a national helpline that's staffed by volunteers, and they will help folks and direct them to reporting if they need to. They take their information on our website at aarp.org/fraudwatchnetwork. We have, you can click on the Oregon map and look specifically at your zip code and see the types of scams that are going on in your community. And we urge people who have older adults in their families who might be more vulnerable to keep on top of that, so that you can talk to your older adults about it, so that they're not, caught off guard. And the one thing we're always really pushing this year is the gift card scams. And so if the IRS will never call you and ask you to pay with a gift card, the Social Security, none of those folks, nobody will ask you and call you to pay with a gift card. If somebody says you're having to pay this bill or this fine with a gift card, it's a scam. Immediately hang up. And also the Department of Justice, the Attorney General's office in Oregon, is very responsive as well.
I'm Joel Corin. I'm the coordinator for this program for the City Club. And I have a question about what a family can do if they're contemplating putting a family member into a nursing home. How can they check to see if that particular nursing home has had complaints of abuse or lawsuits or investigations? Nicole, I think, has the answer to that question.
Yeah. So the great part about our reports is that for all facility investigations, when we're looking into the facility as the alleged perpetrator of abuse, those are all public record. So after we complete our report, we send it to our central office in Salem. They do the pieces that they need to do, and then eventually that document becomes public record. So those reports, those historical reports, are available to anyone who's interested. So we do have a website. It's LTC licensing. So that's long-term care licensing .oregon.gov /backspace facilities. And that will give you kind of the option to search per area and per specific facility to figure out if there's a lot of historical substantiated abuse allegations and claims. The other thing that I would recommend is go there in person, talk to other residents, talk to family members, and if your loved one does move in, check on them frequently. You're as a family member, if the resident, your loved one, is open to you having access to their information, you can get progress notes, you can request the records for medication administration to kind of make sure that things are being given as ordered, and just kind of be diligent and mindful of keeping your eyes open and your ears open.
Okay. We have a question from Kitty Piercy.
So this is a little bit of an odd thing, but I actually was listening to you all, and I think that there is a very big issue about making community kind of more responsible. So having been an elected official, I know that once COVID's over, we'll be back to knocking on doors. And when I used to knock on doors, we many times were approached by an elder in the household with worries about who was taking care of them. And I'm not sure first of all, I'm not sure they know that they have the ability in that position all over the state to see into homes and hear from people, and then what to do about it. So any comments you have about that, I think, or thoughts about that would be appreciated.
You know, like I said earlier, I think that as a society in general, something that's missing is the continued or continuity of care for our seniors. I don't necessarily want to say they're a lost segment of society. However, they are often silent, and through that silence can easily be neglected through just people not paying attention. The neighbor that constantly has the barking dogs and the loud parties and the continual foot traffic and the cars that are parked on the sidewalk get the attention of the neighbors all the time. We're getting constant calls just like that. The dog's barking, too loud of music, too much noise at night, constant foot traffic. Unfortunately, we don't get nearly the same proportionate number of calls. You know, our next door neighbor is elderly and we haven't seen them in 6 weeks. And we don't get that. And obviously not seeing somebody for 6 weeks is not good for a multitude of reasons. But we don't have people calling and checking on their neighbors. And I think that that's changed over time. I think that society 30, 40 years ago was more in tune with who their neighbors were, what was going on in their neighborhood, what the neighbors were doing. People were communicating more. And with the advent of technology, which is wonderful, and I'm very much a geek and have all the newest technology, but you've got people sitting at tables in restaurants and you look and they're texting each other. They're sitting across from each other and they're on their phones texting. And that has a significant negative impact in general, in that we're not talking to people anymore. We're talking to mobile devices. And right here in front of me, I've got a phone sitting so people can reach me, and I'm having to continually check that because that's how they're communicating. And if we're not talking to our seniors, we're not talking to our neighbors, we don't know what they're up to. And that's something that we need to. And then, like you said, you were going door to door. All you need to do is go a couple doors down in either direction. And if everybody was to do that, I think from a community standpoint, we'd be much better. We'd be far more unified, which helps in crime prevention, and it also helps in senior safety.
I guess as a follow-up, I would just say that what I was thinking about, because when I was in the legislature, we ramped up child abuse reporting. And I just think we haven't ramped it up, elder abuse reporting, in the same way, having listened to you. So I think mandatory reporting kind of perspective would say there are people who are out there who have these people in their lives, and they should be reporting when they see something out of concern, not just your friends or your neighbors, but maybe the person who delivers your groceries, or maybe the person who knocks on your door to get your vote. I mean, so I don't know if any of that is going on, but to me, that seems to really up the amount of people who are engaged in watching out for other people in that kind of way.
I would agree with you. And yes, there is mandatory reporting for elder abuse. Nicole, can you talk more specifically? But before you take over, Nicole, the difficulty with the person who delivers the groceries, they're not a licensed entity. So holding the grocery clerk at Fred Meyer's that is the delivery driver to that level of accountability, I think is going to be really difficult. And having been in the legislature, you know exactly what I'm talking about.
I do.
Trying to get that kind of legislation passed where the delivery driver for Fred Meyers, who isn't even a licensed delivery driver, doesn't have to be licensed, they're not going to be held to that. But Nicole, can you talk about who are mandatory reporters?
Yeah, so I won't be able to give you an exhaustive list, but attorneys, I think, just became reporters. That was kind of a new change recently. Obviously, anybody who works for DHS, child welfare, senior services, all of us employees here are mandatory reporters in our own lives, right? So that's 24/7. So I might be at the grocery store and, Kitty Piercy, you mentioned child abuse. That's kind of the thing that people always think about when they hear mandatory reporters. If I see a child being slapped, I am, 24/7 an adult protective service worker. So I am required by law to call. That doesn't mean that everybody is meeting those mandatory requirements, unfortunately. So every individual who works for a facility, which I mentioned earlier, those assisted living, memory care, residential care facilities, they are all mandatory reporters. Teachers are mandatory reporters. But I think the messaging outside of just the requirement is that we should, right? So we should, if we have concerns for somebody and we don't feel comfortable reaching out to them and asking them themselves if they're okay and if they need something, then we should call, because I think it's the right thing to do.
Yeah, thank you for that.
Mm-hmm.
Carmel, you mentioned some of the things that AARP is doing with respect to elder fraud. What other aspects of AARP deal with the issue of elder abuse?
Thank you for that question. Right now, we're really focusing on how isolated people are, and through our Friendly Voice effort, it's a program where people can call directly, and this goes out in all of our materials that people get at their doorstep. So they have this number, and it's the 1-888-281-0145. And you leave your information there and someone will call you back. And that's just an AARP friendly voice that people can talk to. And these are people that are isolated. And, one of the reasons that scam artists over the phone are so successful is that people are lonely and they're isolated and they know that those people are going to answer the phone. So this gives us an opportunity to connect with those folks, and they talk to a volunteer who will listen to them and hear, what's going on. And sometimes we do hear about abuse in those instances that we can report. And also it gives people a safe place to talk to someone that's not right in their circle, so that they feel a little bit more comfortable. And it just keeps them, connected with someone from the outside world, so that they don't feel that they have to talk to that scammer who calls, and because they're lonely, and they'll keep them on the line for a while. So that's one of the ways that we do that. Primarily, our Fraud Watch Network, we do a lot of education. And we do it on Facebook. We have Facebook Live events. We have, when we can, we do in-person events, but we try to do a lot of teletown halls and that kind of information just to get the word out. And we bring in experts from Senior and Disability Services, from the Attorney General's office, from the Federal Trade Commission, from everybody we can reach out to bring them together and get that information out to people as education.
Thank you. In a few sentences, I'd like each of you to tell me what you would like to see either the legislature do. If you had a magic wand, what would you like to see done that would help alleviate the situation with elder abuse? Starting with Nicole.
I think the list is long. We have a long way to go. Carmel, you can probably answer better about the number, but I think it's around 10,000 individuals turning 65 every single day, right? So we've got this silver tsunami happening, people like to refer to. So the resources are just they're so underfunded. You know, we have 20 abuse investigators here to cover Lane County. I mentioned earlier that we have 70,000 seniors per the last kind of records that we could find. And, you know, each day somebody is turning 65. And so there's going to be a point very soon where our team is not able to keep up even close to the need. So additional funding for definitely adult protective services, but also facilities. We're really pretty short on facilities, and people need a place to go when they don't have the resources or ability to be safe in their own home.
Thank you. Brent, do you have anything to add?
Yeah, I totally agree with what Nicole had to say. I guess something that comes to mind to me is, you know, aside from the lack of facilities or lack of programs or lack of funding for programs and facilities, is caregiver compensation. Because I think, you know, sometimes you'll read about this facility and how, like, oh, the, you know, patients were treated really badly or were neglected, or, you know, what's something like a, you know, some minor rash or something became like a deadly infection, that kind of thing. I'm not trying to make excuses for anybody, but, you know, sometimes you look at those facilities and you're like, well, you had a bunch of like 19-year-olds getting paid minimum wage and managing a whole, you know, care facility full of high needs people. So, you know, inevitably this kind of thing happens if people are not given enough training, enough compensation, if there is a, you know, patient to caregiver ratio that is just like not sustainable. So that's just something that comes to mind, because, you know, I don't think many people get involved in caregiving because they really want to, you know, mistreat people. I think most people get involved in caregiving because they want to take care of people, but then sometimes they're not provided with the tools to do that well.
Chief, I'm afraid we've run out of time. So I want to thank you all for a wonderful presentation. And I think that our listeners will enjoy this topic. Thank you.
Thank you for having us.
This has been our June 25th, 21 program. What's being done about elder abuse? Before we proceed, I'd like to recognize our diamond sponsors. Kaiser Permanente. Kaiser Permanente exists to provide high quality, affordable healthcare services and to improve the health of our members and the communities we serve. You can find more information at www.kp.org. The University of Oregon. Support comes from the University of Oregon. Since 1876, U of O has helped Oregonians question critically, think logically, reason effectively, communicate clearly, act creatively, and live ethically. More information can be found at uoregon.edu. It's not UO, it's uoregon.edu. Next is Peace Health. Peace Health is proud to serve Eugene, Lane County, and beyond. As your hometown health care partner for more than 80 years, our mission is to help you and keep you and your family healthy. Learn more at peacehealth.org. Lane Community College. Lane Community College transforms lives through learning. LCC provides comprehensive, accessible, high-quality educational opportunities that promote student success. For more information, visit lanecc.edu. I'd also like to acknowledge our Ruby sponsor, Johnson, Lucas, and Middleton. Support for the City Clubs comes from Johnson, Lucas, and Middleton, a team of experienced, compassionate attorneys fighting for justice. If you have been seriously harmed by wrongdoing and need help, contact us at justicelawyers.com. And then there's our gold sponsors, Sacred Earth Botanicals and Homes for Good. Before we thank our speakers today, I have a few quick announcements. Thank you to our in-kind sponsors, KRVM 91.9 Radio, PAC Info, and Simplified Computing LLC, Dotson's Photography. And a special thank you to public radio station KLCC FM 89.7 for airing City Club programs on Mondays at 7. Our programs are always available on our YouTube channel and on our Facebook page. If you are a City Club member, you can ask a question at a future taping of our programs. If you are not yet a member, you should be, and you can join and then participate. More information is on our website, cityclubofeugene.org. On our next program is going to take place on July 9, and we take off the July 4th weekend. Please join us again on July 9th as we get a legislative wrap-up from Representative Rob Noble, Republican, Representative Dan Rayfield, Democrat, and Representative Andrea Valderrama. Please join us July 9th. More details and information about future programs can be found online at the City Club's website, cityclubofeugene.org. Now I'd really like to thank today's speakers for a great program. Thank you, Nicole Newell, Brendan Gicker, and Chief Bob Morris. This concludes today's program. It's still beautiful out. Be well, have a good time, and stay safe.